welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Vibhu Krishna. She is a medical student and she wrote the Kevin MD article, The Mental Health Benefits of Sharing Stories. Vibhu, welcome to the show.
Thank you, Kevin. I really appreciate you having me here today.
So we'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Absolutely. So my story is a little, convoluted. I came from a humanities and studio art background. So I'm a practicing artist, and I realized kind of the role that art has in the healthcare space, and was driven to this intersection of the humanities and human health. And so I ended up in medical school, and I am between my third and fourth year here in Manhattan at Columbia University, which, luckily for me is a champion of narrative medicine. So that's, it's been wonderful to be here, and quite the journey being here throughout the pandemic. And I'm currently on a gap year where I'm doing health systems consulting work for about a year or so.
And at what point in your background, in your art education, did you decide to make that turn to medical school?
Yeah, that's a great question. I think it's always been for me like a little bit of both. So I always knew I cared about health. There's a lot of physicians in my family, and it's been a very important thing to be, a woman of science and to maintain my own health. And so I think it was, a mixture of that plus, coming across this kind of idea of narrative medicine and of the medical humanities that made me feel like, oh, there is a place for me in medicine. There is also a place for medicine in art. And so it felt very natural.
And we may be talking about this later on, but how has your background in art helped you as a medical student?
It's helped me so much. I mean, just from, the simple things of being able to make anatomy drawings to, some of the more complex things of empathy and trying to break down a patient's story, and some of those skills of like synthesis and clear communication, clear, concise communication when you're attending gives you like 20 seconds to present someone's history. So I think, being able to hone in and zero in on information is one of the tasks of an artist. And there's just so much overlap there. And, also looking through the physical exam, finding details, finding physical kind of differences and nuances that require keen and close observation. I think that's another one that art has definitely helped with.
All right, so let's get into your Kevin MD article, The Mental Health Benefits of Sharing Stories. Now, for those who haven't read that article, can you just walk my audience through it and share the story of why you decided to write it?
I wrote this article, I think around May of this year, and at that time the pandemic was still kind of raging in New York City, and I was seeing some of my own mentors really feeling like they had nowhere to share their experiences, and they were kind of going into this battleground ill-equipped in terms of PPE, and coming back exhausted and then doing it again the next day. And it was almost this kind of thing where, talking to them and hearing them share their stories and having them share them with me and on a platform I created called Faces of the Frontline, proved to be very, very much of a coping mechanism for them. And so that was kind of, the start of it. And then, so the article that I wrote for Kevin MD basically kind of tracks that, why people didn't feel comfortable seeking help, or help wasn't super available to them, and they were facing burnout, fatigue, seeing, people die around them. There was even, there was the suicide of Dr. Laura Breen here in New York, which was extremely tragic. And, even witnessing your own colleagues getting seriously ill. And so storytelling is a form of coping for a provider, and it has proved all powerful at this time.
I talked to a lot of physicians and medical students on the show, and they share similar thoughts like you, how important it is to share their stories, how cathartic it is. Now, can you give any tips to them in terms of how to write their stories? How can they articulate some of the stories that they've seen? Because some physicians are natural storytellers and some aren't. So what kind of tips can you share?
Absolutely. So I think the first thing is knowing the audience, right? If this is like a story that if you're synthesizing information to convey to another provider, that story is going to be different than something that you're trying to share if you were doing public health messaging, for example, where you need to create buy-in, using evidence, but using compelling storytelling to get your message across. So knowing your audience is one. I think the second thing is actually, one thing that providers who have a background in science and stuff might actually be more natural at, which is understanding the neuroscience behind it. And so you have kind of this like auditory or visual, if it's written, kind of input that goes into the auditory or visual cortex. And then you also have semantic natural language processing, which is higher orders of the brain. And we've seen studies, fMRI studies, that show it's not just this left lateralized area that's Wernicke's and Broca's area. It goes well beyond that. There's many higher order processes involved. And so when you are recognizing that you're trying to light up the same part of multiple people's brains, how can I do that? How can I convey this clearly so that what I'm thinking matches what you're thinking? How can I create this like common ground, this common alignment? And I think the answer to that is really just having empathy. And it's so hard, but it is a skill. Some people have it very naturally and some people have to practice at it. But ultimately what you're trying to do is create alignment. And that common ground, I think, is one of the true fundamentals of storytelling.
Now, you mentioned that you had a website where you collect the stories from other clinicians and medical students about being on the front lines of the pandemic. Now, can you share an example of a time where a physician may have shared his or her story and how that helped that doctor?
Absolutely. So I'll give an example of a nurse in Texas who shared their story. Their name is Hudson Colby. And basically they were an ICU nurse, and they had a patient who was at life's end, and because of COVID, no visitors were allowed. And so the nurse is holding up, they sent an image, so this is on an Instagram platform. So the nurse is holding up a sign that says, "I'm just going to stay here for a while, hold his hand for a while. I don't think he has much time left." And another nurse took that photo, submitted it to us, and then we have the story of the nurses in that ICU unit and how they've basically been working around the clock, going above and beyond to provide this sort of empathy-based care. And in one, these nurses got to honor and acknowledge one another. They also got to be seen by the platform, by the audience who reads this. And then the tertiary kind of level to that is, what I was alluding to earlier is the messaging. And so we were, getting responses on this single image saying, wow, this is what's going on. So people are expressing their sentiments of gratitude. They're acknowledging this is not a hoax. They are saying this is why we need to wear masks. So we're even seeing it kind of trickle and transform into behavior change and ideologic change. And it all comes from this root story.
Okay, so if I'm a clinician or a medical student and I have a story that I want to share, what is the next step? What are some platforms that you can suggest where clinicians can share, and medical students for that matter, can share their story?
Well, for one, your platform, Kevin, I think you're a storyteller. I think podcasting is storytelling, and there's actually some interesting fMRI studies on the brain on podcasts too. And then there's also there's tons of literary magazines. I think many medical institutions have their own sort of publication. And, there's of course like Doximity and those sort of wider read platforms. And then you also have the option of publishing books if you want. So we see like Siddhartha Mukherjee doing that. And we see a lot of physicians contributing columns to various newspapers, whether it's, a local one or it's the New York Times or, whatever it is. I think there are many, many platforms accessible to us and all kind of different levels of readership and localization.
We're talking to Vibhu Krishna. She is a medical student, and she wrote the Kevin MD article, The Mental Health Benefits of Sharing Stories. So Vibhu, after reading so many stories from frontline healthcare professionals and medical students, is there something that you know now that you wish you knew back before the pandemic started?
I think if I really had to hone in on one thing, it's the idea of the collective community. And that is like, it's that common ground. And I think especially New York, but also like America in general, it's such an individualistic place. It's kind of every person for themselves. And, you kind of go tooth and nail to get whatever you want and achieve what you want. And this is not a time for that, right? This is a time for everyone kind of taking the L on one thing or two things and compromising to create safety for the community. And so when I hear these stories, and I am so moved by what our frontline workers are doing right now, I kind of look to that. I look to that kind of sense of collectivism and that community and that sense of like real alignment that we need as a society to overcome this sort of thing. And I hope that stays with us past this pandemic.
And my final question, what is your take-home message that you want to leave with the Kevin MD audience?
I'd say my take-home message, I'll leave you with a quote. Hippocrates once said, "It's far more important to know what person the disease has than what disease the person has." And that means that we need to have empathy in our interactions, whether it's listening to the patient narrative, synthesizing the patient narrative to our colleagues, or in these times, sending out public health messaging about what is going on about a crisis. And all of it is based on this kind of this root of cherishing our humanity and really holding on to it, because ultimately when you're stripped down of your health, it's hard to do anything else. And so that's, yeah, I just think it's so important to keep the person first.
Vibhu, thank you so much for sharing your time and insight. And thanks again for being on the show.
Absolutely. Thank you for having me.
Sure.